So if a patient comes in and they are currently wearing a denture, or you can't save their teeth, you need a full mouth of extractions, what are their options in your practices when it comes to dental implants?
Well, I always tell my patients there are a few different options. You can just wear dentures, but that is not an option I usually like to give them.
Okay.
There are clip-in dentures where we put 2 to 4 implants on the bottom and they come in and out. And then there's the option of teeth that are fixed to your jaw.
That don't come in or out. Now, what about the upper? Because the upper with a denture is pretty good, right? It has suction.
As I tell most of my patients, you can do well with an upper denture, but you are going to lose your sense of taste, and they're going to change. You don't get, maybe they get 35% of their chewing capacity back. That's not enough. So by fixing them to your jaw, then they can chew and function and smile. And
so no more dentures? You think is the future?
I prefer no more dentures.
Is that right? So how old can you be? I mean, can you be in your late 70s and get this done?
You can be in your late 90s and get this done.
Really?
If you're healthy and you want your teeth, you should get it done.
How soon can they eat? Right away?
Usually they can eat right away, but sometimes, little softer food diet for a couple weeks.
And before you know it, then what?
Before you know it, they forget that they even have a prosthesis in their mouth. They just eat and chew and forget that they even have.
So steaks or whatever?
Done. Oh, steaks.
What about crunchy things like, let's say, a carrot, biting it with your front teeth? Can you do that?
Yes, you can do that. And you know what most patients say? They say, I can eat a salad again. That is something that most denture patients cannot eat. They don't function well enough to eat a salad.
So eating, what do they like more? The way it looks? Because I've seen some of these before and after photos on your website.
Yeah.
Do they like the way it looks, or do they like what they could eat?
Well, you have 2 types of patients. One that come in, they want their teeth to look nice, and you have the other ones that just want to chew. They get both. Making them look nice is the easy part.
So in your practice, for the bigger procedures like dental implants, things like that, these extreme smile makeovers, most of these people are getting IV sedation.
Yes, correct. Most patients, one of their fears of getting this type of work done is the fear of the procedure itself. And so we offer IV sedation where the patient wakes up and it's over. And
so
they
what
don't
are you
remember.
Monitoring? You're looking at what?
We monitor their heart rate, we monitor their blood pressure, we monitor everything. It's a safe procedure. It's the same type of procedure that you would get when you get your wisdom teeth out.
And I spoke to Dr. Thompson. He says some people forget that they even had it done.
Oh yeah.
Very little memory.
There's an amnesic effect to it.
Really?
Yes. So they don't remember.
And then some people you even have to give a pill the night before because they're so nervous about it. Is that true?
Yes, we could do that as well.
And so, do they usually say, this was a lot easier than I thought? That's what Dr. Thompson said.
Probably 100% of the time.
Is that right?
Oh yeah, they love it. They wake up, they have new teeth. They went in with needing dentures or needing new teeth, and they come out with a beautiful smile. They love it.
So at your center, I guess you do all types of dentistry, not just one thing.
No.
Can you elaborate on that?
Yeah, we do everything from just general dentistry on up to the full mouth fixed implant dentures. So when a patient comes in, we do a complete evaluation. What do they need? We check the health of their gums. We check the health of their teeth. And if a patient is in need of removal of their teeth because of periodontal disease or whatever, or maybe just teeth that are so bad that we can't fix them, then we'll lead them into one direction. If the patient comes in and maybe the bone and the gums are healthy, but the teeth, for whatever reason,
are worn out,
or have had decay, or they've ground them down, well then we have other options that we can do. We can do full mouth reconstruction using porcelain veneers and crowns. So we offer the patients all the options.
So it's not just one thing.
No.
Which is remove the teeth and give them new teeth supported by implants.
No,
you might be saving some teeth.
Yeah, and some people come in and they really think that that's where they're headed because someone has told them that, and they're too embarrassed to go to the dentist and get a real evaluation. So we give them all their options.